If you or someone you know is struggling with a dependency or addiction, know that you are not alone. Check the description of today's episode to find resources that can help you with treatment and recovery. What's poppin', kings and queens from all around the world? I'm your host, Rex Shagay, and I'd like to welcome y'all back to another episode of King's Tales, the podcast series where we help you turn trauma into triumph. And on today's episode, in commemoration of National Alcohol Awareness Month, I have two very special guests joining me in the studio to talk a little bit about the dangers and the effects of alcoholism, as well as how addiction and dependencies can impact our everyday lives. So without further ado, I'll allow them the opportunity to introduce themselves, and we'll jump right into the interview. Let's go.
I am Lamont Josey. I am a licensed clinical social worker, slash certified advanced addiction and drug counselor, slash licensed chemical dependency professional, as well as co-owner of Your Center Counseling Services and Phoenix Center for Health and Wellness.
And I'm Dr. LaKeetra Josey. I'm a psychiatric nurse practitioner, also co-owner of Your Center and Phoenix Center for Health and Wellness.
Awesome. I first and foremost want to thank the two of you for taking time out of your very busy schedules to join me on today's episode. When I was doing my research, everyone that's tuning in, the Joseys are both very accomplished mental health specialists, and when I was reading up on both of their resumes through the biographies that they have presented on their website, I was very, very impressed with their credentials. So I definitely do believe that they have the level of expertise and credentials and experience to really talk about today's topic. So without further ado, we are going to jump right into it. The first question that I have prepared for the both of you is, what role do external factors such as the environment and internal factors such as genetics and behavior play in addictions and dependencies?
Well, that's a big question. It's a big question in the sense that, that's one of the age-old arguments or questions, like nature versus nurture. So what is a person's biology and perhaps what's organic to them, their genetics and all that stuff like that, and then what is it about their environment that would either enforce or predispose or, increase their risk for any sort of substance use or addictive behavior. And the non-answer that I'll give is that it is a combination of both. So we talk about things like epigenetics, where how the environment can impact a person's genetics and genes and their expression. So some people may have a genetic predisposition towards any number of illnesses, but sometimes there's things in their environment or events, or including traumatic events that could occur that would essentially flip the switch or turn some things on, that would make someone more inclined to have or develop some sort of disorder, whether it be a mental health disorder or a substance use disorder.
Okay. Wow, very insightful. I think one thing that I'll say is when I guess just doing my research and just based off of personal experience, I didn't really realize how much of an impact environment does play when it does come to addictions and dependencies. Because sometimes when you grow up around certain things, you don't really notice how much it's really impacting you, even at a subconscious level, because I mean, let's just say you grew up around a whole bunch of family members that were drinkers, and you didn't really associate that with alcoholism, but as you get older and then you start to dive in and indulge in those things, it really does impact your, I guess, your willingness or your susceptibility to start drinking yourself. So.
Yeah, I mean, as far as the environment is concerned, it does. I mean, coming from a social work perspective and like what we were taught with person in the environment, and if that environment is it has alcohol around it all the time with celebrations and different things like that, it becomes a norm. And some people don't realize that they become alcoholic. Some people don't realize they become dependent on it, or if they actually it's become an abuser, which are two different things. And they're just used to drinking, and they're used to that feeling because that's how they grew up, and that's what they've learned. This is they've learned certain things, how to go to church, what to believe in, different, like different things like that. It becomes the norm for them. And one of the biggest issues is not knowing the difference between the abuse and the dependence. We usually just kind of take it as being an alcoholic and alcoholism, but there are differences in the two. Am I right, Dr. Josey?
Yes. There's so when we're talking about a dependence, there's the physical thing. It's the brain and the body needing that substance, and there can be a psychological dependence as well, for the sense of like the mind feeling like it needs whatever substance. In this case we're talking about alcohol, but and then there's the abuse or the misuse, right? Like the intentionally taking in something for the purpose of either getting high or getting drunk, or getting to the point of intoxication because you don't want to feel a certain way, or pick any number of reasons why someone might be choosing to engage in misuse or abuse. Then that there's some lines that are differentiate, but the concern with alcohol and alcohol dependence is the physical and potentially lethal ramifications of the withdrawal. So that's one of the reasons why it's, even though it is a legal substance, it's one of the more dangerous legal substances, because when people are physically dependent, the withdrawal of it can lead to things like seizures and things like that, and people can die.
You see a lot of like nausea, vomiting, delirium, shakiness, stuff like that when it comes from the dependence. A lot of times someone who abuses it may, they it's kind of self-medicate, and sometimes the depression. It sounds kind of alike, but like Dr. Josey stated, the physiologic, I'm saying that right?
Yes.
Physiologic dependence is what makes up the difference, that withdrawal. And if someone's dependent and they don't have it, they get shaky, and they get, like she said, they can have seizures. A person that abuses it can have a higher tolerance, and usually are like people who are in danger of like drunk driving, stuff like that, because they feel like they can actually tolerate more, and they don't get those physiological symptoms, those physical withdrawal symptoms, as much as that person that's dependent on it. So when you talk about it in general, it sounds alike. It can sound just the same on some, for someone who's thinking of it in a layman's terms.
Yeah.
Okay. So I did, as a follow up to that question, because sometimes when I am having conversations with either my friends or my frat brothers, it's almost like nowadays addictions and dependencies are almost interchangeable, but there is a difference between the two, correct?
Yes.
Yes.
Yeah, that's part of the reason we wanted to define them in the beginning, because, like you said, most people do lump them together, and there is a major difference. Both are harmful, but to know the difference really helps when people get like treatment.
Absolutely. So I guess as a follow up to that question, Dr. Josey, I see that when I was reading up a bit on your bio, that your philosophy is guided by Engel's biopsychosocial model. And prior to reading that, I didn't really know what it was, so I had to, of course, get a definition and see what it meant. But for those that are listening and that don't know what George Engel's biopsychosocial model of health is, it is defined as it implies that behaviors, thoughts, and feelings may influence a physical state. So in layman's terms, Dr. Josey, you would probably be better able to explain it than I would. So I'll open the floor to you.
So basically, what we're saying is that a person's body, their mind, and their social setting and surroundings, all of those things come together to influence a person's physical and even mental health at any given point in time. And all those things are all at play all the time, right? Like, we can have someone who has maybe a severe physical illness, but have a great mental health outlook, perspective, and, they engage in treatment differently than someone who maybe has the same illness, but they're, perhaps depressed by it. And so their outcomes are different, right?
Right.
So these things impact each other. And then, when you incorporate the environment as well, do they have access to treatment? Do they have access to the medicines that they need or the therapies that they need? Like, all of those things are coming together to really be that person's, their health status on any given day. And so, I tell people, like, your health status can fluctuate from one day to the next, just depending on circumstances, on your physical health and on your mental health. And so, when we're working with someone, either in therapy or when we're looking at considering medications and things like that, then, we have to be taking all those things into consideration. Not that we can control all of them, but we can't ignore them and act like they don't exist when we're trying to think about what's the best way to help someone move forward.
Okay. Yeah, that definitely does make sense. And during your explanation, you did say something that stood out to me. And honestly, it's a great transition to the next question that I do have, and this is for the both of you. What misconceptions or myths have you both heard pertaining to counseling or mental health services over the years?
That could be a whole webinar in and of itself, but
like in general.
Oh yeah, absolutely. Or I mean, if we narrow it down more specifically, from primarily your Black patients or people in the Black community in general.
Well, I mean, there's the idea that, like, among our women are strong, we need to be strong Black women, and so, seeking help in any sort of way is some sign of weakness, or that we need to be able to continue to take on all that the world is tossing at you. And, if there's any break, then, you're somehow not strong enough, not good enough, not any of those things. And I think that that's a pretty significant misconception. I think the idea of seeking help just in general has been and continues to be an issue, whether it's for ourselves as adults or for our kids when they need it sometimes. And or that, getting help means that, like, and I don't like to use terms like this, but like getting help means that you're crazy or you're broken or you're this, or and any sort of negative connotation to like taking care of your mental health in any sort of way is a failure of some kind, or indicates some sort of personal failure, and that is something that I think we try to combat.
Yeah, from a male perspective. I'm sorry, were you done?
No, yep, you're good.
I mean, from a African American male perspective, I'll say that the highest misconception is that's some white people stuff. You know what I mean? Like,
yep.
that's not for us. We're taught to be strong and hold in our feelings, which usually results in ulcers and high blood pressure and keeping in things like that when you take it on so much, including a therapist. We recommend a therapist have someone that they can talk to. It's kind of like passing the wealth on, and eventually it comes back to you. But when you have that group that you can talk to, or no one can take on so much stuff and not be affected by it. But another misconception is that like Dr. Josey said, if you get help, you're weak. Yeah, it's everybody had the quote unquote crazy uncle or cousin in their family, so I'm not like him, or I'm not like her, or things like that.
Right.
That said, we don't take our business outside of the house. And it's that it doesn't affect us the same way as it does white people. Let me see. Statistics are not. Another thing is, statistics don't mean anything for us.
Oh yeah.
Yeah. And I mean, it depends on if you're talking about that in a general sense or if you're just using it to prove your point. But yeah, those are really the top. Yeah, or we as Black people just don't do that. We don't, and as far as when we do get treatment, it's a lot of times not as successful because we don't give it our all. We're holding back some things. We have this trust issue. Who are they going to tell in the community? Who are they going to tell amongst our specific groups, whether it's a fraternity, sorority, another organization, or anything like that? We have trust issues. And yeah, those are pretty much, and they all affect us negatively. They affect us in a very negative way. And like Dr. Josey stated earlier, some of those things that contribute to the medical issues are because of that mental instability or things like that. So there are a lot of misconceptions and a lot of untruths and a lot of just I don't want to use the word stupidity, but just doesn't make sense sometimes,
No, absolutely.
So yeah,
definitely do agree that misinformation and and ignorance can definitely contribute to those misconceptions and myths being upheld for multiple generations. I would say probably in my own experience, the most prevalent one that I've heard, especially in my household or from family members, is you're here to be seen, not heard. So a lot of the times, a lot of people grow up thinking that, they don't really have a voice. So they kind of keep everything internalized. And like you both said, self-image is a really big indicator. So for a lot of people in social settings. So if, you don't ever want to appear weak or incapable or like you're not in the right mindset to carry out your everyday functioning, but by at least suppressing those things and continue to push it down, it's almost like, like a volcano. The more that you push stuff down, eventually it's all going to come back out. And I've just speaking from experience, back in college, like I was trying so hard to uphold this image of being like the perfect firstborn son and the first one in my immediate family to not only attend college, but to graduate from college. So there was a lot of pressures on me, and a lot of the times, like you carry so much of a burden that you don't realize how much it's negatively impacting you. And I remember this week in particular, like it was yesterday. It was the fall semester of 2019. I had a really bad depressive episode. I was in my room for almost the entire week leading up to finals. And like I was barely eating, I was barely drinking any water, and I was just overwhelmed by all of the things that were going around in my life. And I broke, and it got to a point where I was suicidal, and I was in suicide ideation. And that's when fortunately enough, I was able to come to the realization that, whoa, hey, this doesn't really seem normal, so let me see if I can reach out and get some help. And I reached out to I was a resident assistant at the time, so I reached out to my area coordinator, and they got me in contact with the counselor on campus, and that really helped me to, I guess, process everything that I was going through. And I guess this is my way of telling the audience that if the opportunity presents itself and you feel comfortable and confident enough to do it, then there's nothing wrong with seeking intervention and getting professional help to help guide you through some of the things that you're dealing with mentally.
Okay. I mean, I appreciate your honesty and openness, and to lend to that, I would say that, like, if we just take a step back and recognize that everybody needs someone, like, they need, and maybe as a psych person, I guess I'm biased, but I feel like there should be a psych person almost everywhere. But it's like everybody needs someone that has nothing to do with like their everyday, like not necessarily a friend and not necessarily a family member, but like someone that's outside of your circle that isn't necessarily invested in what happens, right? Like that, yep. That outside perspective that, you can bounce ideas off of, talk things through. Because in friendships and in relationships, there's supposed to be some give and take, right? Like your friend tells you something, you're supposed to care. You tell them something, they're supposed to care. So there's this give and take that's supposed to happen. Mm-hmm. But when you go to like a counselor or a therapist or, a nurse practitioner or whoever, that time is meant to be all about you. And it's very rare, especially the way our schedules are so overpacked and crowded these days, it's very rare that we have a space and a time where it gets to be all about us, right? So if you have an opportunity to go someplace or talk to someone where it gets to be all about you for a bit of time, to actually like take it and use it to your benefit, because and it supports your health in the long run, having that either that support or that outside perspective, where there isn't any other external motivator other than helping move you forward. At least from my perspective, that would be my motivation. Like I tell the people that work with us, our clinicians, I mean, is that like our job is to put ourselves out of business. Like whoever we're working with, our job is to get people to a point where they don't need us anymore, because that means that they're out going and doing and living life and all that stuff like that. So like that's the end goal. Or maybe you only need us a little bit at a time for once in a while for a check-in. But there's times that sometimes you need us more frequently, like once a week. And if that's the case, then so be it. Take that time in order to like get better and be better in the long run.
It's true. Yeah, I appreciate your honesty too. With Sister Dr. Josey said, it takes a lot to admit, us breaking down, especially as Black men, and the subject is sort of turning into more mental health, which, to bring it back to the alcoholism and all this, when it comes to like statistics and all, and when you keep a lot in and you're not getting that treatment, there's a higher rate of people who are not getting treatment for mental illness, that also the end result is usually they experience like a substance abuse or substance use disorder or alcoholism. It's like over 30% of those people, according to a NAMI study, 2021 anyway, that 32.1% of U.S. adults who experience a mental illness without getting the treatment, they also develop a substance use or alcoholism disorder. So the two kind of intertwine in that way to bring it back to alcoholism. And, a lot of them end up being higher risk for cardiovascular and metabolic diseases, and it just trickles down, So you do need to get that help. There's other statistics out there, believe what people may, but it's high when you don't get the treatment. How about I put it as simple as that? It's very high when you don't get the treatment, or even when it comes down to trusting someone. Like you said, you ask someone that you trust, and then they can ask someone that they trust, and you can get to that person that is good for you or can help you out. Even if you feel like it's just a venting or a bitching session, it's good to get it out sometimes, and to see that you're not alone. You're not the only person that's going through something, which a lot of times makes you feel better about yourself, because part of it is feeling alone and feeling like nobody understands and nobody else is going through this. And, when in reality, we live in a fast-paced, microwavable society that everybody wants results so fast that it becomes an anxious culture that we're in right now. Everything is right now. So you have those fields, professional fields that people are in, doctors, lawyers. We have all types of people, engineers, that have alcoholism issues, and that drink in the 60s that they could keep in their desk has become, I'm hiding it now. So now with the hiding it, it becomes more of a taboo, which sometimes turns more into a thing that people really want to be, they want it more to be a taboo because it's kind of an addictive thing, and I'm not supposed to be doing this. You know what I'm saying? So
absolutely,
it can trickle down to many things, and have many type of things come into play that could be combated if you just get the help from start, or near start at least. That makes any sense.
Oh, it absolutely does. And I definitely appreciate this dialogue in particular, especially talking about this kind of stuff, because again, I personally feel that not many people really do have the opportunity to open up, because again, like you said, Mr. Josey, it's it almost transcends into being almost a level of tabooism. Like, people don't want to talk about it because, again, going back to the whole self-image thing, I don't want anybody to think that I'm weak or I'm incapable of taking care of my kids or being able to work or function as a normal human being. But and the reality of it is, by putting ourselves in that box, we're not able to function at our optimum. And in terms of the seeking, actually just mental health services in general, because you both touched a bit about the importance of trust when it comes to counseling. How important is representation and diversity in mental health services? Because I'll be honest, if it wasn't for the fact that the counselor on campus was a Black woman, I probably would have been a bit hesitant with going forward with my counseling, because just because of that level of relatability and having the opportunity to, in a sense, be able to connect just off of shared experiences. So I'll open the floor to you guys to answer that.
I think it's, well, I mean, you said it. It's very important. It's our ethnic and cultural background from a African American standpoint. Like you said, we keep things inside in the house. Certain things are taboo to share. We have different points of views historically, societal-wise, about other ethnicities, in particular Caucasians. It's like, you tell that white person something, they're going to come back and get your kids, or they're going to put you in jail, or those types of thoughts that have us not seek the care. But representation-wise, there are many of us out there. There are, when I say us, African Americans, Black males make up a smaller percentage, but we are out there.
Mm-hmm.
And with things like Psychology Today and Google, you can find us. So the representation is there. We can always say there's not enough, but we're there. And part of what we do at your center in Phoenix is to make sure we're there. For some time, a lot of people thought in just the Newcastle County area that I was one of the only 5 Black males that was licensed, and staying that way because I was also one that would go into, the housing projects and the homes, and I came from North Philadelphia, so what may have been tough neighborhoods for some, I was just like, okay, this is where I meet the person, and that was my training, and they can come into my office anytime, and represent a different way, but I need to see them in my environment. So it took a certain type of person to do that, and we made sure that we actually recruited people who did that in Philadelphia, and so, other parts of Pennsylvania, New Jersey, Delaware, Maryland. So, we made sure that we're represented in this area. As far as females, a lot of times females, they control the control. They are well represented in the field, in the mental health field. Anywhere from nurses to special care workers to case managers. We're there. We are there. What would you say, Dr. Josey?
I mean, I think that the representation is important, and like you were saying, being able to speak to someone that looks like you, and perhaps being able to relate on all right, there's some things that we just don't have to say because they're just kind of taken as a given.
Right.
And so there's less that you feel like maybe you have to explain when you're working with someone, because that person might have a similar or shared experience. And that's really whatever makes a person more comfortable, in order to get them to open up, then I'm like all for it. Some people, some male people may feel more comfortable talking to a female therapist because they feel like if they talk to a guy, they're going to be trying to hold stuff back because they don't want to seem weak to their male therapist. So, you know what I mean? So
right.
I think it really depends on the person. And I think that it takes some self-reflection too, to take a look and say all right, who am I actually going to be open and honest with? Because that may need to be the person that I try to get scheduled with. I don't necessarily need to go through all these profiles and say okay, I just need to talk to a black man. A mixed female may have a little bit of a different perspective, but it might be the outside perspective that could help make something different for you, right?
Absolutely.
So I think it really depends. I think it depends on the person, and who they'll feel like they can be the most honest with. But the representation is important, and I think it's important not only in us providing services, but it's also important for our kids seeing people that look like them providing services too, and not just coming from because we do a lot of work with kids and youth as well. So having kids see people in professional spaces and in professional roles, and looking at these are the helping people. Maybe this is a role that I want to go into at some point in my life, and recognizing that, well, I won't get on that soapbox, but I'll just say that, sometimes some of our evidence-based practices, and you can't see me air quoting right now, but air quoting, some of those evidence-based therapies, they're based on certain evidence and not necessarily applicable across the board to all populations, all people. And so, having people that have the perspective and the understanding to be able to say yeah, I get that there's some evidence for that. However, this is what would actually work in this community. Being able to tweak and understand and modify things appropriately, I think, is important too.
I definitely agree. That was very, very well put. I definitely, and it really is important. That's part of the reason why I started the podcast in the first place. It started as a way for me to, because when I would talk to my counselor, she would tell me, write stuff down and then say it out loud. And for me, at least, that would help me process a lot of the stuff that I was dealing with a lot better. But as I continued to do it, I started to realize oh, hey, this is really showing a lot of, especially a lot of the younger people that look like me, that it's okay to talk about these things. And on top of that, you're not the only one that's going through these things. I feel like sometimes if we feel like we're the only ones that we're going through it, we're a lot more hesitant not to talk about it with someone else. So
yeah, that's a good strategy too, because sometimes when there's that saying of being in your head or getting into your head, or stuck in your head, and when things are up there just in your head floating around, that they're bouncing back and forth in that little space. But when you say it out loud, it sounds very it doesn't have as much power as it does stuck in your head. It sounds like, oh, okay, this is what I was worried about. This is what you know what I mean?
Oh yeah.
It seems like there's more space for it to breathe, and you're just wait, this is what I was given this power to? It's sometimes when you see it, it's just okay, I'm being ridiculous now. Or sometimes it gives you, it gives that moment of clarity sometimes, and it could be oh, this sounds serious. This can sound, or either way, it can go either way. So getting it outside of your head is a good tool. And I'm glad she told you to do that, and more importantly that you followed it. Because yeah, if it's stuck up there, it can have a lot of power, unnecessary power. Um, or vice versa. It can help. It can help. And you get the clarity of how much help you actually need for your thoughts and your point of view. Anyway.
Absolutely.
Another thing that just to go back on real quick on, the relevance of, people who look like us and, having that representation. A big thing that I would do also would, I a lot of clients would and families would say, I just wanted a black male. And I'm just, I would go over that with them, and help them kind of understand why. Because I could be a black male that may have went to Harvard and from, a higher income family or something like, you know what I mean?
Right,
I may not have the same cultural background as someone, that they're actually looking for.
Mm-hmm.
And, I put that on them to actually see that sometimes it's not necessarily the ethnicity, but the culture that they're seeking, and that sometimes that you can't look at things just from a black or white perspective. Some people took that some people took that as, I was highfalutin, or I think that's what it's called. I don't know what falutin is, but and then, some people understood what I was saying, because they knew that that child would have to learn to live in this quote unquote white world, as they, you know what I mean, and that, sometimes we have to go outside of our ethnicity to actually trust and get the help that we need. And sometimes the understanding comes more from a cultural perspective than it does an ethnic one. So that was big with because I was getting so many people, and it would be like, why do you want a black male? And some would say, because he doesn't have his father, or his father's not acting right. And I'm like, from whose perspective? Like, I'm not going to be that man that another black man against another one because you want to go against his father. You know what I mean? So it's different perspectives you have to look at too. Get that person to look at them. So I just want to add that in there.
Absolutely. And it's actually really funny that you mentioned perspective, because that's honestly been a big topic of conversation over the past month within our church. Sometimes we allow our experiences to impact or pollute our perspective, and it can definitely hinder us from really enjoying future experiences. So if you've had a negative experience in the past, like, sometimes that can hold you back or allow you to be a little bit hesitant from, venturing out or trying something new because of that past experience. But sometimes you really do have to get that healing in order to get to the next step. So I definitely agree with that. Right. So now on to the next question. Based on both of your experiences, what are some of the effects that alcoholism has had on those suffering from it, as well as their families and friends?
Yeah. I mentioned some of them earlier with, on that person, there can be, medical issues, those physical ones. Those mental issues and all of that trickles down to your loved ones and those around you. So it that whole person in the environment thing, everyone in your environment, it can affect whether you feel like it does or not. Even if it can affect the people that you may currently are around.
Yep.
And relate to who you end up being around. You know, so it has, you know, Dr. George, if you want to get more into like detail, I mean, I'm speaking in a general sense, but
yeah, I mean, so there's the physical effect with repeated alcohol use, and a lot of times I think we miss that other people probably pick up on an issue with us before we may be aware of it, or an individual might be aware of it. But like for the individual, we have to look at what alcohol is, and I'm getting this like weird echo. I'm sorry. So like for the individual, it's a nervous system depressant, and when I say that, I mean like it shuts things off. So it slows the heart rate down, it slows breathing down, and sometimes when people are feeling anxious, they feel like they want that, right? Because they want to slow down their heart rate, or they're hyperventilating, so they want to breathe more. They want to breathe more slowly. But it also shuts other things off too, like things that are supposed to be turned on, like things that would tell you, no, don't get in that car and drive right now. Like we would call that the inhibition, right? Like it turns that off too. Like it doesn't get to be selective. It just like it's across the board. It suppresses the nervous system. And so, so from a physical standpoint, when the alcohol is not there, you see a rebound. So like you'll see a rebound in the heart rate, like you'll see a rebound in the blood pressure, meaning that it'll go back to normal and sometimes shoot up. So that's where we see the high blood pressure, or like we'll see an issue with respiratory issues, with like breathing issues and stuff like that, because the depressant isn't there anymore. Or, you know, we're regretting some decisions that we made because we were disinhibited and we made maybe some poor choices, and now we've got a DUI, or, you know, maybe we engaged in sexual activity that we normally wouldn't have, or, you know, just we spent some money that maybe we shouldn't have spent, like that, those types of things that can happen to the individual, that also impact other people, right? Like, so God forbid you happen to end up in an accident under the influence and, you know, you hurt someone else, or, you know, you are at risk for losing your job because you're coming to work impaired and you don't recognize how impaired you actually are. Like things like that sometimes get, you know, because it's such a nervous system depressant, like we don't really recognize how much it impacts us until, unfortunately, sometimes there's consequences, and negative consequences for excessive use, or like using in times that like it's not okay to.
Absolutely.
And then, you know, what it trickles down to family, you know, depending on the level of use and what it means for kids. You know, sometimes, you know, you've got, the descriptions of the angry drunk versus the, you know, emotional drunk, or it's like, oh, he's been drinking, let's make sure that we stay away, because if you're in arm's reach, you're going to get hit, or something, you know, like things that go farther than what they would if that substance wasn't part of the mix. So, you know, it impacts kids, it impacts families, it impacts marriages and relationships. You know, when there's a financial strain, especially if you're taking money to go, you know, spend it on alcohol instead of paying a bill, then, you know, that's when we're getting into a disordered space. And sometimes, because it changes our brain so much, like that's one of the things that's such an issue with addiction, is that people don't always fully understand, is that substance changes your brain and tells your brain that you need this substance more than you need anything else. So you need this substance more than you need food. So people will choose alcohol over a meal. So now you're drinking your calories, and like, it's mostly sugar, so you're leaning towards diabetes now, you know what I mean? Or, like, you need this substance more than you need to, like, go to work today, or, you know what I mean? So, like, there's ways that the brain changes, and it's especially dangerous for kids, because their brain is still forming. And so since their brain is still forming, we're setting a pathway, or we're setting ways of, reinforcement, and we're setting ways of coping and behaving, and we're setting cravings if kids engage in using alcohol and stuff like that at those, like, brain development times.
But even those, and of course you would know more about this than I, but you speak of kids, and those are the children that are actually already born. But when you start talking about stuff like fetal alcohol syndrome and stuff of that, you get into something where that dependence or abuse by pregnant women, it's, that's a whole nother story. When that fetal alcohol syndrome in the U.S. is said, well, I don't just say the U.S., but I mean that's an issue as well. If you're dependent, it's like, I just need one drink and it'll be fine. I heard someone say, you're fine if you're pregnant and you drink water after a drink, and I'm like,
it's just like none of this works that way.
Yeah, I'm like, what? Will it clear out something? Like, and I mean, but that's the information that people get, and I'm like, what? Yeah, she's like, well, I'm never drunk, and I'm like, drunk? Okay, all right. I'm just like, okay, but I mean, so when you talk about families, you're talking about your current family and your future family, it can affect, so it definitely has those negative effects on people.
And from a physiologic standpoint, for men too, like, too much alcohol can result in impotence, decreased sperm count, like inability to maintain an erection. So there's, physical effects that way as well, which could then impact your relationships too, right? So, but and so coming back to that whole, like, the bio, the psycho, the social, like, instead of taking it and saying, like, all right, this piece, so, like, we're just focusing on this addiction. It's like, no, we can't just focus on this one piece, because it impacts so many other things, right?
Right.
Like, if you're drinking your calories and you develop diabetes and now you have to be on insulin, like, that's your physical health. Even though, like, this was, we'll put alcohol use in your psychological space, right? Like, now we've gone into your physical space, and this is now going to cost you something, because you've got to pay for extra supplies, and you've got to pay for all this other stuff, and now potentially you're looking at a shortened lifespan because you have a life-limiting illness because of something like this. And so we sometimes try. I don't want to villainize people that like to enjoy a drink here or there when they're celebrating.
Absolutely.
But we also, like, I also want to recognize that there's a legal substance. Like, there's the illicit drug use, absolutely, but there's a legal substance that is killing a lot of people as well.
Absolutely. Well, once again, very wonderful and well thought out answers. I learned a lot just hearing the both of you talk about, some of the effects that alcohol does have on our lives. And one thing that I will say, I didn't really, after, again, looking at Engel's biopsychosocial model, I didn't realize that sometimes our, not only our behaviors and our thoughts and our feelings will impact our physical state, but, our personalities as well. I'm a very competitive person by nature, and I actually I I was initiated as a member into Phi Beta Sigma Fraternity Incorporated spring of 2018, and I didn't realize that being especially in a Greek life setting, and this is something that I feel like kind of goes a little bit undiscussed. You don't realize how much of an influence the culture of Greek life can be on your I guess your alcohol consumption. But I was already a very competitive person, so when I was in those settings with other black men, and alcohol's involved, like obviously you don't want to be in the you personally, you don't want to be like, oh, okay, well, I'm not gonna be the only person here that's not drinking, and then taking a couple shots turns into excessive binge drinking, and before you know it, like you're in a state now where you can barely function, you're not cognizant, and you never really want to be in a situation, and just speaking from like a social standpoint, especially in today's society, you don't want to be a black man in a certain situation where you don't have control over yourself. And there's always we always hear so many negative experiences of whether it's athletes or superstars when they get in that state where they they end up doing something that they don't even remember the next day. And I didn't realize how negative my behavior was becoming, and how dependent I was becoming on alcohol until one day I really did do some reevaluation and some introspection. I was like, you know what, I might need to talk to my counselor about this and figure out what the best course of action is to hopefully get this under control. And I found something that worked for me. And I honestly, this is a really great way to segue into the next question, because I feel like we've been talking so much about the negatives of alcoholism, which they are present, but also too there's ways for people to get treatment and recovery. So we talked a bit about it earlier, but how could someone go about seeking help for treatment and recovery from alcoholism?
So really, I think that would depend on their level of use. And for some people, it may start with a conversation with a counselor first to determine, like, all right, how much are you using? What happens when you don't use? Like, what do you experience physically? Because some people, depending on how much they're using, they may actually need some sort of medical intervention, like a medical detox. And that's, like to get the alcohol and so really the benzo, the thing that's suppressing the nervous system, to get that out of their system safely without them having seizures or stopping breathing or any of that stuff that. So there's that like higher level of treatment. And then outside of that, there are programs like intensive outpatient. So like our treatment program is an intensive outpatient where people would go 3 to 4 times a week for 3 hours a day, where they have counseling and group therapy, and they have an individual counselor that's working with them and peer support, or they may need to work with somebody just on an outpatient basis on how am I going to pull back on what I'm doing. Like if they're not ready to engage in that higher level of treatment, working with a counselor to discuss how they can decrease their use and how they can do it safely over time. Because sometimes people get to a point where they're like, all right, I'm just going to quit drinking. Well, if you've been drinking a liter every day for the past like 4 months, like that's not a safe thing for you to do, right? So like it helps to get a little bit of to get some perspective from a trained professional and actually like point people in the right direction. Because when people do the like, well, I tried to stop and I wasn't able to, so I may as well just keep going. It's like maybe you tried to stop, but maybe it wasn't the appropriate way to try to stop. So again, getting that outside perspective and some guidance, because you may not necessarily know which way is the best way to go. And it is possible for people to recover from substance use, alcohol use disorders, and things like that. People celebrate years of sobriety, months of sobriety, and every day sober for some people it's another day and another day to be celebrated, especially if it's in comparison to what they were doing before. And people notice the differences, like their perspective on things, how they feel in situations, how they process things, like the reflexes are better, just things that they may not have been able to attend to because their nervous system was so depressed or so suppressed when they were using alcohol, that, they can engage in life in a different way. And, like being able to actually engage more fully and not be disconnected from the situation because either their anxiety was getting the best of them or, whatever it was. You're living life more fully and more authentically, I would say.
I mean, as far as being able to get the treatment, and I think first, I think to add to what Dr. Josey was saying, I think you have to have a certain perspective and a certain how can I put it, a certain realism, or you have to be real with yourself and saying that I either believe I'm ready or I want to be ready, and I'm going to be open to this because I can easily plug our business and say we're located at such and such, and here's the phone number. But seeking treatment is as easy as Google. Treatment facilities near me, IOP facilities near me, and that's the good thing about it. Some people saying I can't find it, but you can find the nearest whatever when you want to find it.
Mm-hmm.
But
yep.
I mean, and that's just the beginning of being serious about it. When people come to us for mental health or substance abuse treatment, shameless plug, we can provide both. We can, we can, we can tell you what to do, but you have to be tired of being tired. You have to be ready to be open to some things, or, we have people that come and they tell us, oh, I've been through this before, what's different? And I'm like, yeah, there's nothing different when it's the truth. You know what I'm saying? Like, so you have to be open to it this time. Or stuff like that. And that perspective changes, when you're serious. You start to see, how you were acting, like you stated earlier. You start to see, what you missed out on. And you're 40 years old and you've never been out of Delaware. And these are two situations. It's like, that's pretty bad. Like you've missed out on life so much. And kids are growing up, and people are leaving, and people are dying. I mean, the treatment is out there. There's different levels of treatment. A lot of people need to go into detox, or, certain levels where you start at residential, then you step down to intensive outpatient. Sometimes there's a step down to a residential treatment home, which is outside of those, it's more of a free space area. You have free living, not as many rules. You have to have the rules for yourself. But you have to follow a certain program out in the community. Outpatient is more, it's a step down from that, where you may be going to see a therapist once or twice a week. And these the level. Well, there's step-down levels, although you're reaching a higher plateau in your recovery. If that makes sense. But it's out there. I mean, it's as easy as, and I'll say, calling your center, 302-298-3818. And if we're not the people, the good thing about us, honestly, if we're not the ones that can help you, we'll tell you that.
Mm-hmm.
And
yep.
we set up networks with other places, other providers that can help. Whether it's in your area, you're talking about, it's the technical world now. We can do video sessions. You know what I mean? And some
Right.
people like, I don't like video sessions. If you're serious about your treatment, you'll get a lot out of whatever treatment you're seeking. Out there, just listen, just seek it, just Google it.
Right.
It's there. Ask around. If you're an addict and you've been an addict for years, the people around you, it's most likely one of them have been with some treatment facility, or they're going to tell you the one not to go to. You know what I mean? So
Yep.
you can eliminate that one. So you'll hear people say that there's no resources out here. That's not true, and that was part of the reason that we developed and started our companies. It wasn't because there were no resources. It was because more people were not sharing the resources. And that's part of our educational piece that we do. There's a lot of places out there, believe me, but everyone's in their own little corner, and they're doing really good work. And especially nowadays too, with Dr. Biden, the first lady, that being her thing. Like every first lady has a thing. That's her thing.
Right.
And being in Delaware, there's a lot of money coming here for substance abuse, alcoholism. You understand? You know what I mean?
Right.
There's a lot out there. So, and particularly because they're from Delaware, there's a lot of money being given to programs, and if you ask, they have to spend the money.
Right.
But a lot of times people go to places because it's cold outside, and you got to be serious about wanting the treatment, because it's out there. It's too many places to name. That's why I say Google near me or ask around. It's
Right.
Or like I said, I gave our number. If you're not near us, then we'll point you to some other places. Go to our website. We have links to other places, or where to go to find other places. So it's out there.
And one thing I'll honestly commend the both of you on, especially with myself being in healthcare as well, it's very rare to see, especially with certain fields of healthcare, some providers won't refer their patients to other practices because they feel like they have all the answers, or I'm more capable than them, or I'm more experienced, or I have a higher level of expertise, or they'll try and downplay the other offices. But one thing I will commend you on is the fact that you're willing to refer people if you feel like you don't have the resources, or someone's too far, or you don't feel like you're going to be able to provide the optimal amount of care. Like, that you're able to refer people to someone else that you feel might be better suited for them. So that's a huge plus.
That was one of our main things. It's not. It may not affect everyone directly, but somewhere down the line, these people who are addicts are raising children who are going to school with your children, and with technology out here, you're sharing information that they're sharing.
Yep.
People don't think like that, and they need to. So when it comes to referring, we're big on the whole problem, not just us.
Right.
Believe me, it's enough money. We live in and I always say this to Dr. Josey, we live in a capitalist society. Everyone is looking to make the money, and money makes the world go. Our society goes around it, but you have to have a certain kind of personality, a certain level of compassion, empathy, to really work in this field. And when I say really work in this field, it doesn't become about the money. People are, you can't get rich off of this field. So
right.
Diversifying is a whole nother story. But it's yeah. I mean, so this is a national, international problem. It's all over. We're all affected. People driving with DUIs, and you can be driving in another country in a DUI. So it's a worldwide problem. So We have to take that perspective to get whoever to help, especially if they're seeking it. You know.
Yep.
You don't wanna deter them. You want them to seek. If that person can help the person that was gonna might be driving drunk near you,
Right,
so,
right.
Yeah, so that's definitely our approach.
Again, I definitely appreciate the answers provided, and for those that are tuning in, just know that once you're ready and willing to make that leap, Mr. Josey said it best. Like, just go on Google. I mean, we live in a technological age now, and everything's literally at our fingertips. So you can Google counseling or mental health services near me, and I can promise you that you will find someone out there that will fit exactly what it is that you're looking for specifically. So, and also, of course, you guys have been, of course, plugging your businesses, and I will definitely, once the episode is finished, with editing and I get it uploaded, I will definitely include the links to both the Phoenix Center and your center in the description below, so that people are able to access it, and even if they don't need it for themselves, that they're able to spread the word and let others know, especially those in the Northern Delaware, Wilmington area that might be looking for whether it's counseling or therapy for addictions. The resources are there, and both Mr. Josey and Dr. Josey are very well experienced and credentialed. So I wouldn't even have them on the show if they weren't. So it's, they have all of the resources available. And one question that I did want to ask, especially for those of us that are younger that are tuning into the episode, like, how do you both juggle being professionals, parents, and business partners? Like, what is that like?
I well, we met. I wouldn't say at work, but I was a director at a mental health facility, and my wife was a
grad student at that time.
And so I always had respect for her work, and her compassion and willingness to do certain things, and I think that has grown over time, because my wife is an exceptional nurse practitioner, student, teacher, and I tell her all the time that that she is. So there's a certain level of respect that I have for her work, although it may not sound like it sometimes, because I'm coming from also a business perspective,
right?
With being the owner of it. So we do disagree many times on perspectives and what we should do, but I think the level of respect ends up being the factor for me. I know even from a business perspective, my wife is going to deliver the care that I've never had to, that I've worried about in the past in different positions that I've held, whether it be management, clinical director, or whatever. And I've held a few in Delaware, Pennsylvania, New Jersey. And, the care that she gives, although it may not sound, it may sound direct, she's giving you the best care from facts, and however she takes to get the facts, you have the best care. We work a lot. We have a 9-year-old and a 21-year-old.
Wow.
My previous marriage, who is at North Carolina A&T now. That she does well in school, so that kind of tends to help us out, that we don't have to worry a lot about her. This 9-year-old, she's under us a lot, and we do go on vacation, and I mentioned earlier, trying to diversify in the things that we do, whether it's financially or hobby-wise, or it's a lot of work. Believe me, it's a lot of work.
Oh yeah.
It's a lot of work, but yeah.
It sure sounds like it.
And actually, one of the things that, so part of the reason that we started your center was because of how we had both worked in positions elsewhere, and just, we could see enough of how people were being treated and how it didn't really align with not just like what we felt like people deserved, but like best care even. And so rather than complaining about it, it's like, instead of talking about it, like be about it, right? Like, so we decided we were just going to go ahead and work together to build this, build a program. And I have to credit Lamont with how much it's grown, because, and we've talked about it, like even in my mind, what my original thought of what Eurocenter and even Phoenix was going to be was probably smaller than what we are. Mm-hmm. But we've expanded because of the need, and we've expanded in order to meet the need. And we may not be able to help everybody all the time, but the people that we can help or that we do reach, we're going to put our all into helping them, right? So it's, for us, it's definitely much more about quality than it is about quantity. And we made that decision from the beginning. So I think agreeing on that on principle has been has been kind of like the way that guides us. And like Lamont said, we may not always agree on everything, but there's always a mutual respect. And even in the times when we're like looking at each other like, you're not necessarily my most favorite person right now, but we still like, there's still like a respect underneath that. Like there's just a knowing underneath that, like, okay, even outside of this, we'll move past this and get back to liking each other because we're in this together. Like we balance each other out. Where he may be more open to taking on risks and things like that, I'll be watching to make sure that he's protected in anything that he goes out to do. So I may be more of the enforcer sometimes when it comes to the business standpoint, or the risk management or the whatever, but and it is a lot, but it did, and I think it required a bit of a shift. And Lamont, I have to credit with it because he had more of that vision than what I did initially. Because I came up, or was like, got a job at 15 and have never not worked. And even when I was in grad school, like I had like 3 jobs, and in grad school, like a full-time student. So like it's like I've never not worked, but and I can't even say like now it's not like I don't work, but it's working for ourselves. And right. Putting the same energy and investment and time, but that much more into it because it's ours. And, like wanting to take a break here and there, but not being able to because it is ours and we have a business to keep running, and we have, people that are working with us that have committed to working with us, so we feel a sense of responsibility for, making sure that they have the opportunities that they need so that they're satisfied in the work that they're doing, and, they're getting the education that they want, and the therapists or the clients that they're seeing are getting, the information that they need to treat people appropriately. Like that's always been a really big commitment for us. So it wasn't just about having a mental health practice or a drug and alcohol program, but like having a means and a platform to provide education. And education to, because I'm a giant nerd, so like education to the clients, like education to, the clinicians that work with us, education to the families of the people that are the clients, education to the community as we like try to provide service in a space and show that people can and do recover, whether it's from mental illness or substance use. And even with kids, like we were doing some work with schools to like teach coping and emotion regulation and problem solving, like from the beginning, right? So like if we can empower kids and put that stuff in their toolkit from the beginning, we're building up a kid rather than repairing an adult down the line, right? So, I mean, that's a nursing thing. Like, we try to do more prevention than treatment anyway. So it is a lot to manage. And like Lamont said, we have the 9-year-old she's her own person, but she's watching and seeing us do our own thing. And, you know, when we talk to her about why we're busy or why it is that we're doing what we're doing, we're explaining it. It's like, we're doing this so that we can, you know, take care of the people that we've agreed, you know, we're taking care of, but it's also so that we can do the things that we want to do in our life. Like, we do the things that we have to so that we can do the things that we want to, right? And she is seeing it. I mean, I think she sees it more on a day-to-day basis than, you know, our older daughter does, because she's away at school. But like, she sees it, and so she'll ask me, like, what's it like to be a boss and be the boss, or what's it like what's it like to have your own company, and what's it like to do this, and what's it like to do that, and so, like, from the beginning or from a young age, she's getting that idea of, this may be a path that I'll be able to take for myself down the line, and, you know that she would be supported if she wanted to try to do something for herself. So, you know, she doesn't necessarily have to take the same path that everybody, I can't say everybody does, but like, her path may be different.
Very, very well put. At this point, I feel like I could ask so many more questions, but we've already gone over our threshold. So let's close out. What words of encouragement would you give to some of our viewers or listeners who would want to one day attain the lifestyle that you both have created for yourselves?
Obtain the lifestyle. Your freedom to work for yourself, maybe.
That works too.
To stay focused on the things that you have a passion for and want to do. If you're in this field, don't think about, you know, necessarily, you know, the money you can make, because honestly, that comes with money comes with your passion, and if you're doing it, you're going to have a different view of money anyway. Because what I've learned more of anything is to have an open mind about diversifying in things, whether it's real estate, finances, or anything of that nature. You know, you're going to have that time and the mind freedom to think about it, because you're going to have pleasant thoughts, and you're going to be like, oh, let me test this, and your point of view is going to be different when you go different places. You'll look at things differently, you know. You'll and be like I said, be focused. You have to focus and plan some of the things that you say you want. Try to be as realistic as possible. You know, you have to put in some work. You know,
a lot of work.
a lot of you know, times this is, like I said earlier, the microwavable society, and you know, people, oh, I got my degree, so now I want to go and rent someone else's property, and the people are going to come swarming in to see me. You know, clients have way more intellect than a lot of us think. You know, they know what they want sometimes, even more importantly, they know what they don't want. And then when they, you know, so in that respect, you're number one, you're paying someone else's property off instead of thinking about how you're going to buy something for yourself or buy into yourself, you know. I've always been big on ownership and trying to figure out what you need to do, like Dr. Josey said, doing what you have to do so you can later on do what you want to do. Find out what you have to do, not going around it, not going under it. You have to pay your dues. Whatever those dues are, pay them, because it will come back. You know, if you don't have the knowledge, someone's going to sue everything out of you. So you have to be focused and ready to work. So I don't know if that's encouraging or
it sounded pretty encouraging to me. So
and I just kind of tell people from an education standpoint, I think you want to look at what, and even when if you're considering college or you're considering graduate school or any of that stuff like that, like look at what you would actually be able to do on the other end of it. Like, would that degree end up in a license that lets you do, therapy or something like that? Or is it like a master's degree in order for you to say that you have a master's, but it doesn't really translate into anything that is in the field of what you want to do?
Right.
And maybe that's like thinking like 10 steps ahead, but if you don't know, then ask someone. Like, you don't have to go down this whole path of like, oh, I went to this information session, they told me I could get a master's in like 10 months and like but at the other end of it, you can't really do anything with it. So like, right. I'm very adamant about like getting that information, and I tell people, like, if you want me to look at programs, like I've built academic graduate programs like from scratch. So
wow.
I've reviewed people's programs, not to say like this is a good program or a bad program, but to say like, how does this fit with what you want to do down the line? Sometimes people aren't comfortable with answering those questions, and then it's like, okay, if you're not comfortable answering those questions, then like you might want to take a step back before you're thinking about this like end goal thing that you want to do, but this path that you're on isn't going to get you there. So like, I think having some humility, and if you have someone that is being a mentor to you, being a good mentee, right? Because for me, like, mentorship means I'm, taking some personal responsibility for helping someone else to be successful. And because I'm doing that, like, that mentee person should be taking on the responsibility of like, I want to make sure that I make myself worth my mentor's time. You know what I mean?
Right.
Because we don't have, like Lamont said, money will come, but time is something that we don't get. Like, we don't get it back. Like, no matter what you do, like, whatever you go and do, and make all the money in the world, it's not necessarily going to get you more time in your day. It's not going to get you more time in your life. So you want the time that you are spending doing things to be worthwhile and meaningful. And sometimes it might feel like you have to go through some BS stuff to like get to that meaningful thing.
Right.
But if it's a means to an end to get to what you want to do, then I would recommend spending that time. And I know that we have to go, but I do have to. The nurse in me is making me say just one more thing about alcohol. Like, I know we have to close up, but the nurse, the clinician in me, like, feels like people need to also understand the challenge or the issue with mixing things with alcohol. So, like, if you are drinking, like, alcohol plus Red Bull, right? Like, so we're taking a stimulant and a depressant at the same time. That's creating an issue. Because our brain and our body is an amazing thing. Like, our brain's whole focus and purpose is to keep us alive. So, like, if we were drinking and drinking and drinking, eventually we'd throw up or we'd pass out to stop us from drinking. Like, our brain would make us do that. But when we do other things that counter that puts us more at risk for things like alcohol poisoning. So, like, the Red Bulls and the vodkas, like, you've got a stimulant that will stop you from passing out. So now you've increased the risk of alcohol poisoning, or mixing something like alcohol and unfortunately a benzo like Xanax or Ativan or any of those. Like, that's a double whammy effect. Like, normally you'd pass out or you'd vomit. The benzos like Xanax and Ativan, they'll keep you from vomiting, so that's going to make you more likely to have alcohol poisoning. And if you do pass out and vomit in your sleep, you aspirate and you drown in your own vomit. That's a bad thing, right? Like, so that's just my little nursing, like, public service announcement about not mixing anything with alcohol should you happen to engage in drinking. I had to do it. I'm sorry. I know we were over time.
No, I'm actually glad that you brought that up because, again, I know the primary focus was alcohol and alcoholism, but again, especially nowadays, and it's a lot more popularized and glamorized in the media. People aren't just drinking alcohol nowadays. It's a lot more of the illicit drugs, and it's not just marijuana. Like, people are doing Xanax or comethazine, promethazine, stuff like that, and mixing it with alcohol. And like you said, when you put together stimulant and depressant, not a good combination. So I definitely, once again, I just want to thank the both of you for dedicating time out of your very busy schedules to do this interview with me. The knowledge and the value that people are, well, I hope that people are able to get as much knowledge and value from it as I was. And again, I'm extremely grateful for you guys, just even saying yes to this, because you didn't have to.
You're welcome. I mean, we're glad that you just wanted to at least get some valid and some truths about this topic and subject. So we thank you for offering us a chance to do that. We're appreciative as well. We really are. Okay.
Yep. I don't have anything else to add other than thank you.
Well, no problem at all. I'm really glad that I was able to once again conduct this interview, have you both on the show, and I definitely do feel that it's gonna at least help out as many people as possible. So that's always the objective with doing these podcast interviews. So once again, a huge thank you to Mr. Josey and Dr. Josey for their expertise and their time. Without any further ado, I'm your host, Rex Shege, and I want to thank each and every one of you for tuning in to King's Tales. Be on the lookout for the following episode for next month, and I will be sure to include all of the necessary resources and links in the description of each episode, so you guys are able, if you are in the northern Delaware, Wilmington area, and you are looking for mental health services or therapy or counseling, whatever it is that you may need, all the links will be in the description below. So again, you're not in it alone, and there are resources out there that can help you with combating whatever it is that you might be dealing with. So that is all I got for today. Everyone have a wonderful rest of your weekends and stay safe.